In response to my opponent's claims, I'd like to first point out that they have no adequate response to our evidence showing that this act in and of itself infringes on our personal liberties as an American. They suggest that it's not necessarily a penalty, but an encouragement, or that you do actually have a choice between signing up for healthcare and paying this tax penalty. But that's like saying you have a choice between a rock and a hard place. There's no true choice there. You either pay the American government a tax penalty and remain without coverage, or you are forced to pay for a healthcare plan that may or may not actually cover everything you need to cover, and most likely will cover more things that you don't actually need in your plan. They also claim that the congressional, and they make a claim citing the Congressional Budget's Office estimate showing that it would cut budget deficits by several hundred billion. What they don't tell you is that when James Capretta, a writer for the Center of Health Policy Studies and an expert in domestic and economic issues specializing in healthcare reform, found that upon a close examination of what the Congressional Budget Office said, there was further evidence that makes it clear that the deficit reduction associated with the American Affordable Care Act is based on budget gimmicks, sleight of hand, accounting tricks, and completely implausible assumptions. While pushing for the Affordable Care Act through Congress, President Obama took the position that it was no longer necessary to pay for this doc fix. He proposed to add the cost to the national debt, but did not want to show those costs in association with the Affordable Care Act because they would explode the myth of this deficit reduction. So his solution was to pass this fix in separate legislation, but it doesn't matter that it is not officially associated with the Affordable Care Act. Taxpayers are going to be paying this money one way or another. The federal government's finances are crappy, to put it nicely. It's the reason why lawmakers were worried that this Affordable Care Act would make it fiscally unsound, and I believe that we've proven successfully that it does. Now, they also made claims towards the fact that a lifetime limit being put in place essentially makes you safe as of 2014. But they offer no reason or evidence to show that any type of lifetime limit spending, when American taxpayers are paying for it, is in any way sustainable. Now, those lifetime limits are in association with extra spending that they justified with Medicare and Medicaid, citing that if you're under this 400% federal poverty level, or under a certain limit, which is 138% of the federal poverty level, that you'll either be eligible for Medicaid or at least some subsidies to help you pay for these costs that you're now mandated to have. I believe that actually is a problem in and of itself, because you're increasing spending, you're increasing funding to Medicaid and Medicare, which is already a completely flawed system. You're targeting taxpayer dollars to population, or by targeting taxpayer dollars to populations truly deserving of public assistance and pursuing fundamental reform of basic structure, it only adds to the program's existing flaws. It leads to substantial increase in cost to taxpayers and dramatic swelling of the number of individuals who are going to become more and more dependent on the government paying for their healthcare bills. The Congressional Budget Office and Centers of Medicare and Medicaid Services project that the Affordable Care Act will increase federal spending in Medicaid between $75 and $100 billion annually. Now, I don't know about you, but it seems like to put more and more money into a flawed system, into a flawed act, is only going to dig our hole deeper and deeper. Yes, we are resolving that we should repeal the Affordable Care Act, and yes, we are resolving that we go back to the system that we had before this, because we had a system in a free market where people had free choice to choose to spend or not to spend, to insure or not to insure, to protect themselves. And yes, that is your choice and right as an American to choose. And if you choose one over the other, there's no judgment, there's no penalty. You make that decision yourself. If you incur medical expenses and you don't have insurance, absolutely, and you know, saddens me to say that this did happen, but that was your choice. And I think the true flaw with the Affordable Care Act is that it removes choice from Americans. It removes your civil rights, your civil liberties.
You've got 30 seconds of prep time left.